Hi, everyone. I'm Kimberly Diamond, Executive Director of the MI Lupus Foundation, and I'm joined today by Jessica Barker, who is a compliance specialist with Axios HR. So welcome, Jessica. Thank you for joining me.
Thank you.
And we're here today to have a conversation about lupus in the workplace. And this is a topic that will be relevant to almost all lupus warriors if they are able to continue working with the disease. And there is a national statistic that estimates that only 30% of lupus patients are employed full-time. And so that really speaks volumes to how much lupus can affect someone's day-to-day life. So I'll go over it just in case anybody doesn't know. Lupus is an autoimmune disease that causes the body to attack its own healthy tissues and organs. And so it can affect any part of the body, causing widespread pain and inflammation. And common symptoms include fatigue, joint pain, fever, and lupus affects everybody differently, and it may go into periods of flares and remission. So for our purposes today, talking about the workplace, some symptoms of lupus that may interfere with someone trying to do their job would be extreme fatigue, loss of mobility, painful joints, especially if you're typing a lot, to get swollen joints in your hands. Fluorescent lighting in the office place can trigger a flare in some people if they're very light sensitive. There is a need for increased sick time. Anyone with lupus is high risk and more susceptible to getting COVID, flu, or other workplace illnesses in that common setting. And lupus is also extremely unpredictable. I say every day is a surprise party. So it makes it especially difficult to plan, especially with work attendance and having a consistent presence at work. So after a lupus diagnosis, if an individual wants to keep working and they feel that they can still do their job, but maybe may need a few adjustments, they have the right under the Americans with Disabilities Act to ask their employer for reasonable accommodations. So I'll ask you, Jessica, if you could summarize for us, what is the Americans with Disabilities Act?
Yes, so the American Disabilities Act, which commonly is referred to as ADA, it is an act that prohibits discrimination with anybody with a disability in several areas. I mean, today we will be focusing on employment accommodations for current employees as well as job seekers. But it really does put in a lot of protections in what you can have accommodated in the workplace. And oftentimes these protections aren't thought about right away. So it's always good to have those like initial conversations, obviously. But from a very general blanket statement, it basically gives you that protection in requesting those accommodations, and it holds your employer accountable to provide those reasonable accommodations.
Okay, great. And that leads into our first question, and I can add some of my own personal experiences in this, that I've had lupus for almost 17 years and have worked and have not worked or been self-employed. So I've experienced a lot, especially since I've had the disease for most, if not all, of my professional career. So the first topic is when should an employee disclose a lupus diagnosis in the workplace? And again, sharing my own experience, when I was first diagnosed, I immediately had a boss that told me she couldn't have a sick person working for her. So in that in itself is a violation of ADA. But because of that, I tried to hide it for many years, not wanting to be treated any differently than my coworkers or viewed as like I couldn't do my job. But my lupus progressed to a point where it was impossible to hide, and I did end up needing special accommodations in the workplace. So ever since then, I've been very open about it with any employer, and especially open about it during an interview process for a higher level management position, because again, it does affect my everyday. So if someone chooses to do so, approaching their company to disclose an illness like this can often be the hardest part, especially since lupus warriors or anyone with a chronic condition tend to not like to ask for help. So Jessica, if you could tell us, what are your recommendations on when an employee should disclose a chronic health condition?
Yes. So kind of a twofold with this, as anyone with any autoimmune disease, and especially for this lupus, knows. One, I love the term lupus warrior. That's just a beautiful way to describe that, because it is. Unfortunately, anyone with an autoimmune disease knows, as it is typically what they call a silent disease. It's not seen on the outside visibly, whereas if someone broke their leg and needed an accommodation to be in a sitting position all day, it's apparent their leg is broken, they're in a cast. When you have to internalize all of your disability because it's happening internally versus exterior, that just becomes a trickier thing for other people to sometimes understand, and it's often overlooked. Unfortunately, that means that lupus warriors are very good at having to advocate for themselves, and sometimes that does turn into not wanting to ask for help. From doctor's appointments all the way through employment, it's a struggle to get people to listen, and I do feel there's a shift in society kind of helping along the way with autoimmune disease sufferers as it is right now, and we'll use the word warriors instead of sufferers. That's a lot nicer and more true. So with that being said, people not understanding fully what's happening inside, especially if they've never known or experienced personally what an autoimmune disease actually is doing to your body, it can take a little bit more sensitivity to get them to understand what your needs are. So open and clear communication is always very important. I always encourage people to be honest with themselves first and foremost. So taking that time to journal when you're feeling symptoms at work and at home both. And a lot of people wouldn't think about the home aspect, but there may be things at work that would be triggered in the future that you already know will be a trigger for a flare-up for you because of things in your daily personal life outside of work, things like fluorescent lights and different experiences like that. So I think when you're ready to have that conversation, and what you should be disclosing is going to be very particular to where you are in your journey, from diagnosis and moving forward. If it's new, you may be going underneath a lot of different medication adjustments and a lot of different changes with medical treatment. And so it's going to be important to be able to communicate that. And that really should be done as soon as you're comfortable. There's nothing that requires you by law to disclose that you have a disability or an autoimmune disease. However, in order to get any sort of ADA accommodation, you will need to disclose some things. So as soon as you're able to get a well-rounded idea of what your needs might be, that is the best time to go forward with speaking to your either future employer or current employer. It's not a good idea to jump in and say, I just found out I have this, I don't know what's going on, I don't know what's happening, I need all of these appointments off, and just bombarding somebody with that. Approaching it in that way is probably going to send off a red flag that it shouldn't, but it probably will. And if they're not familiar with it, they're going to immediately be on high alert from a risk standpoint. So it's very important when you do have that conversation that you can at least be honest with where you're at in the journey. And it's completely fine if that's, hey, I got a formal diagnosis last week. I know there's going to be some things happening quickly. I'm going to need some time off for appointments. I'm going to need some time off for this. I already know this is a condition of a flare-up that I'm having, and it has to do with reason X, Y, or Z. You are very much entitled and should have those conversations as soon as you're at a place where you can identify some of those points. You do not need to disclose extra information at any given point in time, but in those first few conversations to begin that interactive ADA process, it's very important that you just have an understanding of what some of your expectations are as well.
Okay, yeah, that's extremely helpful, especially I never thought about, journaling or or being really introspective about, okay, I know this isn't working for me, or I need special accommodations, but what are those exactly?
Yeah.
So that's helpful to be prepared when you are ready to disclose that to your employer. And you touched on it a little bit, but my next question was, is it possible to disclose too much? Because I know that sometimes I have felt I brought it up at the incorrect time. When I was interviewing for another position and got to the final round, I brought it up. And this was pre-COVID, so working from home was very taboo and misunderstood. So I brought up that I needed to work from home at least one day a week. And that kind of spiraled and went down a rabbit hole of the committee asking if it was contagious and am I going to give it to their constituents? And why do I need to work from home? They just didn't understand. So I obviously didn't share it in the correct way at that point. So as you said, it's natural for an employer to or interviewee or interviewer to have questions about it, but you only need to share information that is relevant to your position and how it might be affected by lupus symptoms. So in your opinion, can you share too much?
I don't know that you can share too much per se, but it is more about that timing aspect. I also feel there's a big difference between, to your story, an example, when you're interviewing versus when you're already employed. If you're already employed, you know that relationship with your supervisors and your direct reports. You know what that dynamic is, and you probably have a good idea about how that conversation would be taken, and it can kind of help you prepare in that way. Again, this is where that introspective journaling can be very, very helpful, because you'll already have an idea of what accommodations you may need. And part of that is speaking with your doctor early on as you're going through the process of seeking a job or continuing employment while you have lupus. In terms of oversharing specifically, again, it's personal. I myself just tend to overshare everything. I'm a hard on your sleeves type of person, and I'm very much of the mindset that nobody is a mind reader. So if I need something, I need to advocate for that. But when is key. So during the interview process, maybe you're not bringing it up during the hiring conversations, but you need to wait until you have an idea fully of what that job is going to entail. We all know what's put on Indeed or LinkedIn or whatever other source you may be leading you to apply for work, that it's not going to give a list of all of your job responsibilities. So your responsibility in trying to figure out what you need to succeed in this role that you're applying for is going to be key, and you're only going to figure that out during the interview process. So making sure you're coming prepared for interviews with a list of questions. If you have a general idea of what the job will entail, that's very helpful. You can base your questions around that, but also be mindful of future questions where those triggers that you might have in your personal day-to-day life outside of work would be very helpful to rely on those types of resources as you're asking these questions. Questions can range from, how long will I be required to be under a fluorescent light? Are there remote options? Are there hybrid options already available? Because if it's a company that already does support hybrid work opportunities, that's a very easy conversation to have. Where if they say, absolutely, we require everybody be in office all the time, that gets a little bit trickier. And while remote work has been proven to be very successful, I have still witnessed lots of people that have used early stages of COVID as the guideline for how remote work was successful for them, in which case it was not, because it was early COVID and there was a lot of chaos and stress. And that, to me, is not a fair representation of the success that remote work brings. However, a company is within their right to say remote work is not a reasonable accommodation. That's kind of that key in ADA, is it has to be a reasonable accommodation. However, you are within your right to push back. You are within your right to say, well, if I could work Mondays remote, those are my light days. We have no meetings. We won't schedule meetings. I can just do my work, and 9 times out of 10, if you have an office type setting job, that work is capable of being done remote. So just knowing what your expectations are and kind of understanding what the job you're applying for or what your current job and its future state might entail will really help you ask the right questions as you're moving through the interview process or the conversation with your HR team after a diagnosis.
Okay, yeah, and when we talk about special accommodations, as I mentioned, everyone is different. And so the accommodations that a lupus patient may request depends on how lupus is affecting their work abilities, in their personal role. So I think the most common accommodation has been a modified work schedule, just due to the extreme fatigue that we experience. And as I mentioned, I personally need to work from home at least one day a week because of that exhaustion of getting up and getting ready. So in your experience, what is a reasonable accommodation for someone to request?
Yes, so twofold again, because nothing's ever just a black and white, as it's such a complex system here. Reasonable is that key word again in there. So sometimes it's just knowing what the job is going to entail. Remote work, I feel like, is a very easy to accommodate option, whether that's permanent remote or hybrid remote. I feel like that's always a very good place to start. And especially with lupus warriors, fatigue seems to be the one symptom that is consistent pretty much across the board, at least in my experience. So with that, you already know, okay, that explains my inability to, get out of that inertia period in the morning so easily, and that exhaustion midweek creeping up on you harder than it would a normal functioning person whose body wasn't actively attacking itself. So absolutely, remote work is where I would start every baseline, and I feel like that is 9 times out of 10 a very reasonable accommodation for most industries. Obviously, if you are in a factory on a factory line, that's not going to be an easy accommodation. However, there are even options in non-office settings that are easily accommodated. Those can look like certain types of what we would still classify as PPE, wrist braces, different, if your knees are what the joint that hurts, your ankles, your feet. I know it affects every joint. So different safety measures in place to maybe relieve some of that pain. You are absolutely entitled to request that your HR department know about your disease and provide you with a wrist support or a knee support or an ankle brace or something along those lines. Those are always reasonable accommodations that anybody can easily accommodate, and that should never be pushed back as a unreasonable request. The ability to have frequent time off for appointments and things like that is reasonable. If your employer does not have a hybrid or remote work option, even a request ADA, even though it isn't FMLA, can still allow for leave and times off of work to fall under that reasonable accommodation. So if you know that your exhaustion gets bad, you're not going to be able to work remote, that's already been taken off the table, the next conversation would be, is there an option that I could come in, paid or unpaid, 2 hours late if I have a flare up? Or, can I have 6 hours a week to dedicate to time away from the workspace to allow for restorative healing and just kind of reconnecting and getting over those moments of exhaustion? I know a common symptom can sometimes be that inertia in the morning and it taking longer to get out of that phase. And so sometimes just having a 2-hour window, if your day is supposed to start at 8, coming in at 10, that can help some people, depending. Again, everybody is very different, both in how it affects them and where they are in their journey. So it's important to, again, be very responsive and understanding of what your needs are. Changing light bulbs or allowing lights to be off, providing desk lamps that don't have that strong UV light, providing screen protectors that prevent that UV light from coming through your computer screens if you're on the computer screens all day. Oftentimes, if you wear prescription lenses, you can request that they provide the extra blue light coating if you don't already have that in your glasses with your prescriptions. That will also help with computer UV lights, phone UV lights, things like that. As technology continues to advance, UV light, unfortunately, that blue light is still really strong, and it really, I mean, it affects everybody with or without lupus. It's a dangerous brain game there. Those are very reasonable. Sometimes having extra support, help, saying, hey, I do very well Monday through Thursday, but come Friday, my eyes are exhausted, my body is exhausted, my head is exhausted. I really need more support to finish these reports. Just being able to have that support in place and knowing who that person is for you. And that can come from conversations with coworkers or your HR team, but just you need to know this is the person I go to when I have that help. Not every time I need help, I need to start this process all over. Having those conversations can be very, very helpful. Sometimes even a reasonable accommodation could look like an assistant that's with you all the time, or somebody that just handles part of your job that you'd maybe dictate instead of have to type. So truly the list of accommodations is quite lengthy. And in my opinion, if you feel like it's reasonable, if you feel like it wouldn't put an undue hardship on your employer, absolutely ask for it. And those conversations in that interactive early stages also take place with your doctor, and they can also be a great source for what they believe could be an accommodation to help with a certain symptom.
Yeah, and I think once you have that open dialogue as well, and you know that you're supported by your employer, they may bring up things that you didn't even think of. I know when I first needed assistance and they approved me working from home, they then also added an assistant for me, which was amazing. And that wasn't something I asked for, and it just kind of alleviated, some of that extra stress and burden during the week. Or if a lupus patient doesn't have a handicap license plate, still having a close spot for them so they don't have to walk. And I had amazing coworkers that when we had a meeting, they would make sure it was on the first floor and I didn't have to climb stairs up or down to have a larger meeting. So I think if you're lucky enough to have that open dialogue in a workplace, that things will come up that you didn't even think of, where people can offer that additional support
Yes.
for you. But that does lead into my next question, that sometimes receiving some of these special accommodations can lead to some unfair behavior by coworkers. And as you mentioned, chronic illnesses, especially when they're invisible, could make you a target for coworkers who do not understand your situation and may be jealous of some of the accommodations. I know I've had coworkers that also asked to work from home because I was working from home. And again, just not understanding that I would, if I was healthy enough to be in the office every week or every day of the week, I would much rather have that situation than have to stay home one day a week. So, and coworkers may make comments or pick on you if you're late during the day or just need additional time to get your work done. So what are your thoughts and advice for a lupus patient that may be experiencing unfair treatment from their fellow coworkers?
So yes, everything you just said is unfortunately not an uncommon situation. Again, when you're a lupus warrior, you get used to advocating for yourself. You get used to being the only one in the room that understands what you're feeling. And what you're comfortable sharing with your coworkers is completely dependent on you. You don't owe them any explanation. If it's a situation where there's bullying, gossip, rumors, harassment, just even side comments that are being made directly or indirectly, if you hear through the grapevine, I always recommend everybody document everything. The last thing you want to do is get into a he said, she said battle over something that's already hard to understand, because it's just not productive. Not because somebody is going to assume you're lying or making it up, but just because odds are if someone's being a rumor mill bunny, they're going to also become very defensive when confronted with that. So knowing that you only have to disclose what you wish to, you don't even have to tell them that things are being covered under ADA. You don't have to tell them your time off is covered under ADA or your remote abilities or the catering to conference rooms. That's something that they don't have a right to know, but you are within your right to share should you choose. I always say document every time and report it to your internal HR. If you start to feel that your internal HR isn't taking things seriously or things aren't stopping, that's when you might want to reach out to others, reach out to support groups, different things like that for better advice, legal advice, things of that nature, should it escalate to something of that need. The same as with your internal HR and your coworkers. Nobody has a right to know your specifics. So even during this ADA and interactive process, you don't legally have to disclose any of what your symptoms are. Your doctor can fill out paperwork that will state clearly what your accommodations need to be. And that is truly all legally anybody gets to know. What you choose to share beyond that is up to you. Sometimes sharing and being a little bit more vulnerable from an education standpoint can be very helpful, both from personal experience with my own health and from what I've experienced in the workplace and in the legal area, is that education can go a very long way. However, when you've been living your life, I mean, you've been a warrior for 17 years, like you said, advocating for yourself and being the only one to have to explain this and advocate can be exhausting. And so I would have those conversations with your HR team, whether that's a team or one person, your supervisor, and see if there's any room for education within the workplace on a higher level. And that can look like different discrimination and anti-discrimination trainings, not discrimination trainings, and just kind of education on what some disabilities may look like on the outside versus what's happening on the inside, and just reminding employees to be respectful of their coworkers, because with or without an autoimmune disease, everybody's facing a battle that no one knows about. So it's always a good idea to have those conversations from an HR standpoint as well with your employees, just to help them understand. But if there's retaliation or harassment, like I said, because you might get to work hybrid or work remote. That's a current situation that I've recently dealt with somebody where the supervisor was retaliating or very unhappy about this person being allowed to work remote. And I'm in a unique position where I'm advocating for clients as well as employees and just trying to bridge that gap in understanding. And ultimately, we did reach a good space, but then the same situation, coworkers started saying, well, if they can work remote and I'm doing the same job, why can't I work remote? And it's truly just your HR team standing firm in what they're doing and what they're supporting, and just explaining this is a reasonable accommodation. This is why this person is working remote. This is not a hybrid or remote office. It is something we are allowing this person to do because we support our employees. That's what's crucial.
Right. Yeah, and like I said, I think anyone who needs special accommodations in the workplace would much rather be healthy and not need them. So it's just like you said, that education part of it as well, to kind of alleviate some of that additional stress. But let's talk about long-term disability and medical leave options. That lupus can be an extremely isolating disease. So many lupus patients do enjoy the social aspects of work and would much rather be in that environment from a social perspective. But the disease does get in the way. As I said, it's unpredictable, where someone at some point may need to consider a medical leave or choosing to seek long-term disability. I know I myself have been on 2 medical leaves, and luckily they were paid. But not every employer offers that option. So what has been your experience with employees that need a medical leave or ultimately decide to choose long-term disability?
So with needing a medical leave, it's important to know, and this has its own stipulations, but FMLA is always a good option. The Family Medical Leave Act, lupus is protected under FMLA. Every business does not have to comply with FMLA. It's 50 or more employees. But what's also important to know is maybe you're in an office with 12 employees. So you think, oh, I can't be on FMLA because we don't have to comply with that. but your company is under an umbrella of companies that have several different entities and businesses. Those are all incorporated and count towards that number from a federal level. So just making sure, if you feel like you don't qualify for FMLA due to the size of the business you work for, just truly checking that that is the case. That's always the first place I recommend starting, mainly because you can do it continuous or intermittent. And that would allow you protection from your job, whether you needed a week, 2 weeks. I mean, it's up to 12 weeks in a year. So you could take a full 12 weeks should the need be, or you could use it intermittently, and it could help protect from those rough mornings or rough exhaustion days where you can just call in and say, I'm not going to be in today due to my FMLA protected reason. And that has a lot of protections with retaliation laws. That's something that the government actually does very seriously and takes very seriously. So you do a very good job with making sure employees are protected while under that leave. And it guarantees your job safety. Maybe not always your same specific role, but it protects your pay, and it allows you to be in a similar role in terms of seniority and things of that nature. So that's always a first kind of go-to when it comes to a leave. However, you have to work for a year or X amount of hours. You might not meet that qualification either when you're diagnosed or you're starting a new job. And if you get that job with these accommodations, even if it's an FMLA compliant workspace, you still would have to wait a full year with that job to be able to utilize that FMLA. So knowing that that is another layer, I have found more often than not, most employers are willing to give similar leaves if their company doesn't meet those FMLA requirements. Again, FMLA is an unpaid leave, and sometimes that can be too harsh. If you are a big provider for your family, the sole provider sometimes, or just your pay is required. We are in a rough economy right now where I don't know too many families that can afford to have somebody just not working and not having any money come in. It's very hard to be in a single income family right now with just the way the economy is sitting, and the economy is always going in waves. So it's good to be prepared. With that comes usually for short-term disability is what you would apply for. So anytime you're allowed benefits, if your employer has employer paid any benefit, that's always an easy yes. Short-term disability can be hard with a lupus diagnosis. If it's a pre-existing diagnosis, doesn't mean it's not going to be approved. I've seen it go both ways. So I would always recommend starting. With short-term, I would also always recommend, even if it has to be a paid benefit, if it's offered and you can afford to have that short-term, long-term, always elect it. You just never know when you're going to need something like that. So I encourage everybody with any autoimmune disease to always elect that option in their benefits. There's also private options for short-term and long-term disability out there that you can go through outside of your employer if you're not comfortable disclosing everything with your employer at this time. Sometimes that can look like a better option. Or if you're currently not working, but you're actively trying to work and you don't know what your benefit situation will be like for a little while, finding a low cost option can be helpful. Long-term disability is easier to obtain once you've started with short-term, because long-term disability doesn't kick in until you've been noted to be out of work for 180 days. So if you have a history where you've had to utilize short-term for maybe shorter moments, that will count towards that 180-day period on 90% of policies in Michigan. So that's a very good place to start. When you roll into that long-term disability, it's not a challenging thing to manage. However, because lupus is still, it's not taboo, that's not the right word, but just not talked about as often and as frequently as other diseases are, it can be more challenging to prove. And that's a very unfortunate thing that I hope shifts as we continue to learn more and more about all the different ways our bodies are reacting to different autoimmune diseases. And I think we learn of new autoimmune diseases all the time, and there's more frequent diagnoses because we're able to know what to look for and what to test for to actually get quicker turnaround times on some of those diagnostic testings. So all of that is to lead to hopefully an easier world one day, but for the current state, it does require more hoops sometimes, and just being patient with that process and very on top of everything, making sure if they need an independent medical examiner that you understand fully, ask questions. Don't ever feel like you can't ask a question or you shouldn't ask a question. I recommend always writing down some questions, like I said before, even for your interview process. Same when you're talking to your doctors and claims adjusters for any short-term or long-term disability. It's always important to ask any question that comes to mind, and having them written beforehand can sometimes just help, because everybody knows in the middle of conversations, your brain can go into 4 different areas trying to answer and keep up and understand what's being asked. And that's what's going to consume your brain during those conversations, not the questions you may have had going in. So just making sure you know that you have that space to always ask. If something gets denied, I recommend everybody appeal at least once. If it continues to get denied, maybe take a moment and talk to your doctor and see if they can think of why it's being denied. There's a lot of resources from a legal perspective out there that can help you with some of those things as well. It's just important to always have a full picture of what's happening at all times and just keeping up on top of things. There'll be a lot of doctor's appointments, a lot of documentation. With long-term disability, every 6 months or so, they'll require a recertification. They typically own that piece of the puzzle, reaching out to your medical facility, getting that documentation. But again, the current even working economy and work climate is everybody's short-staffed and short-handed. So sometimes adjusters are so overbooked that they don't reach out when they think they need to, or don't reach out right away when they should be. So it's important to also remember that you can advocate for yourself, even though it can be exhausting and you've been doing it for so long. You have that right to that benefit should the need arise.
Yeah, it's extremely helpful to know what your options are. And I know just from having so many lupus warriors contact us that getting a long-term disability claim is extremely difficult, even with the supporting documentation. And if anyone needs additional resources, we do have one contact who is a disability lawyer that's able to assist. But given everything we've discussed so far, if again, great to know your options for disability. And if someone does want to continue working, they may consider a career change if their current job isn't a good fit, especially if they've tried special accommodations and looking into disability, and maybe they need to decide that they should be looking for a job in a different field, especially if it's physical work or demanding long hours, that even with the accommodations that we've discussed, it may not be enough to provide that relief that someone would need in certain lines of work, or supervisors or bosses may not always be understanding of your condition. So as you mentioned, we encourage lupus patients to advocate for themselves. They're their own best advocate, and make their health a priority and make the best decision for their ultimate well-being. So I'll ask you, is there anything else you want to add that would be helpful information for our viewers?
Yeah, I would just end on a note of knowing that you are seen, that you're valid, that you're not any less worthy of being an employee, and you're still fully capable of working, and just knowing what your limits are and being comfortable enough to set up boundaries. That's going to be what really proves success for you from every angle. And just being honest and giving yourself a little bit of extra grace if you need extra help. It's okay. It's expected. You don't have to fight alone.
I think mentioning that, or telling anyone watching and any lupus warrior that we still have value is a big one, because it's very easy to feel like you don't have anything left to contribute to society, and that's not the case. Just the way we work may look different than anybody else. So I'll encourage anybody, if watching this, if they have additional questions, they can comment below. We'll post this on our social media. And if it's a complicated question, we'll run it past Jessica and get her official response on everything. And thank you, Jessica, for your time today and very helpful information that is going to help a lot of lupus warriors.
It was my pleasure. Thank you.
Thank you.